In this explainer, we're going to break down the essential anatomy and physiology that you absolutely need to know for your NHA/CPT certification exam. But, more importantly, this is the knowledge that's going to help you provide safe, effective care out there in the real world.
Okay, let's just jump right in with a really important question. I want you to think about it for a second. With all the things you have to learn, all the procedures, what's the one skill, the one area of knowledge that truly underpins everything else you do?
And the answer is having a really solid working knowledge of human anatomy and physiology. I mean, this isn't just background info you memorize for a test. It is the fundamental blueprint for every single blood draw. It's what keeps your patients safe and your lab results accurate.
So in this first section, we're going to build that exact foundation. We're going to lay out the universal framework for describing the human body. And believe me, this is absolutely critical for safety and for clear communication with the entire healthcare team.
Everything, and I mean everything in anatomy, starts right here with the anatomic position. You've got to commit this to memory. It's our non-negotiable starting point, our point of reference, and it's always the same, no matter how your patient is actually sitting or lying down in front of you.
So here's the key takeaway, and this is a big one for your exam. Directional terms are constant. They never, ever change. The basilic vein is always medial to the cephalic vein. It doesn't matter if your patient is sitting up, lying down, or standing on their head. Medial is always medial.
Okay, so building on that foundation, let's learn the specific language we use to describe locations on the body with perfect accuracy. When you master these terms, you're not just sounding professional, you're ensuring your documentation is precise and your communication with nurses and doctors is crystal clear.
Let's start with two of the big ones, medial and lateral. Medial means toward the body's midline, and lateral means away from it. So think about the antecubital fossa, that area in the bend of the elbow. The basilic vein is medial, it's closer to the body. The cephalic vein is lateral. Mixing these two up is a critical error you just can't afford to make.
This table here kind of wraps up the essential terms you need to know cold, and you can see how each one has a direct, hands-on application for us. Proximal and distal tell you where you are along the arm, while superficial and deep are key to understanding why we can easily access veins but have to be super careful to avoid those deeper arteries.
Okay, let's get super practical now with something that is highly testable: how we position our patients. This is really where your knowledge of anatomy connects directly to preventing complications like fainting and, of course, making sure you get a good quality sample.
So let's walk through a scenario you're definitely going to face. A patient sits down in your chair and says, "Just so you know, I always get dizzy and sometimes I even faint when I get my blood drawn." What do you do? What is the only safe choice here?
The answer is simple, and it's completely non-negotiable. Supine. That means you have the patient lie flat on their back. For any patient with a history of fainting or anyone who just seems really anxious or dehydrated, this is the only correct and safe position. No exceptions.
And listen up, because this is a major safety rule and a huge NHA exam alert. Trying to draw blood on a high-risk patient while they're sitting in a chair is considered a critical error. Your number one job is to prioritize safety, which means you recognize that risk and you immediately get them into a supine position.
So this chart gives you a nice overview of the most common positions. You'll see the word syncope. That's just the medical term for fainting. Now for your exam, you'll want to pay close attention to the angles for semi-Fowlers, which we use for patients who have mild difficulty breathing, and high Fowlers for those with severe shortness of breath when lying flat. Knowing when and why to use each of these positions really shows you know your stuff.
So, we've spent some time on the body's external framework. Now let's dive a little deeper. Let's go inside to really understand the body's internal organization. And this is so important because it helps you understand what the lab tests you're collecting are actually measuring.
You know, the body is built up in these levels, from the tiniest chemicals all the way up to complex organs. And your job in phlebotomy? It gives you a direct window into the health of every single one of these levels. A simple blood test can show an imbalance at the chemical level, a problem with the cells, or signs that an organ isn't working right.
Pretty much all the tissues in our body fall into one of these four main categories. When you perform a venipuncture, you're passing through epithelial tissue, that's the skin, to get to the connective tissue inside that blood vessel. And I want you to pay very close attention to that example for connective tissue. Okay, highlight this, circle it, do whatever you need to do. This is a classic exam question. Blood is officially classified as a connective tissue. Now, why is that? It might sound a little weird, but it's because its cells, the red cells, white cells, platelets, are all suspended in a liquid matrix, which is the plasma. You'll want to remember that fact.
All right, in our final section, we're going to tie everything we've talked about together with one of the most important concepts in all of physiology, homeostasis. We're going to see how the body maintains its internal stability and what your critical role is in measuring it accurately.
So what is homeostasis? Well, the easiest way to think about it is as the body's continuous, delicate balancing act. It is constantly working behind the scenes to keep things like your temperature, your blood sugar, and your pH levels within a very, very narrow and stable range. When a disease disrupts that balance, it shows up in the lab values from the blood you collect.
And this right here is a perfect example. The pH of human blood is one of the most tightly controlled values in the entire body. A shift, even slightly outside this tiny range, can be life-threatening. That is homeostasis in action.
This table really shows you just how high the stakes are. Just look at the consequences when these key values fall out of their normal range. An imbalance in sodium can lead to seizures. And please, pay very close attention to potassium. An imbalance there can lead directly to cardiac arrest.
And this is where it all comes back to you and your technique. Hemolysis, that's the bursting of red blood cells, often caused by a poor collection technique, releases all the potassium from inside the cells out into the sample. This creates a falsely high, life-threatening result that can lead to dangerous, improper treatment. This is an extremely common NHA exam topic, and for very good reason.
So let's wrap up with this final thought. Everything we've covered today, it's not just abstract information for a test. It is your professional responsibility. This is the blueprint for safety and for accuracy that begins the moment you walk up to your very next patient.